Here we are, sir. Mistake. Well done.
Thank you, Chef. We're going to take a look at skeletal and muscular injuries. The formation of our skeletal system is vital to us in a number of ways. It provides us with form, it protects our vital organs, and it allows for muscle attachment, which enables us to move. It also produces cells that are vital for our survival. Also, an added bonus, taken from a cow, it is absolutely delicious.
The musculoskeletal system is comprised of muscles, tendons, ligaments, and bones as a framework, and enables us to perform complicated tasks such as movement and even talking. We will now look at injuries that affect this system. A fracture can be described as a break or a crack in a bone. This is usually as a result of direct force being applied to the bone or indirect force transmitted from one side to another. A simple example would be if you were to fall on your outstretched arm. This may result in a broken collarbone, or a fall from a height when you land on your feet. This may result in a fractured base of the skull. Fractures are classified as either stable or unstable and open or closed. With a stable fracture, the broken bone tends not to move, either because they are completely broken or because they are jammed together. Such injuries are common at the wrist, shoulder, ankle, and hip. Usually they can be gently handled without causing further damage. The broken bone ends can move out of position. Such injuries need to be handled very carefully to avoid further damage. In an open fracture, there is also a wound at the fracture site, which may be caused as part of the injury or may be due to one of the broken ends protruding through the skin. Infection is always a possibility, not only to the wound, but to the bone itself, which can cause delayed healing. Initial treatment in this case will have to address the wound as a priority and the fracture as a secondary concern. The bleeding may be stopped by the application of direct pressure and then dressed prior to immobilizing the fracture site. It must be stressed that all fractures require careful handling to ensure that no further damage occurs and the pain is kept to a minimum. A closed fracture results in a break or crack where the overlying skin is intact. Although the bone itself may be displaced, which increases the risk of further damage to underlying tissues, increased pain, bleeding, and shock. Closed fractures can occur anywhere, but the most common are near joints. For example, the wrist, shoulder, ankle, or hip. The main aim of the treatment is to immobilize the fracture site to prevent further movement, reduce pain, and limit any further internal damage. All bone has its own blood supply, and when the bone breaks, the vessels will be damaged or completely severed, resulting in blood leaking into surrounding tissue and causing swelling. Immobilization can be achieved initially by supporting either side of the fracture by hand. However, you can self-splint with the patient's own body. For example, tying the good leg to the broken leg with padding in between is a good method, and frees crew members to perform other tasks. On your vessel, you already have a variety of different splints that enable effective splinting to be made for different fracture sites. These proprietary splints come in the form of wooden slats, inflatable splints, box splints, and vacuum splints. Dislocation can be described as a joint which is either partially or fully pulled out of position. As all joints are held in place by ligaments, there is likely to be soft tissue injury to the ligament or muscle formation around the joint. Dislocations are often extremely painful and will result in loss of use of the affected joint. Common sites for dislocations include the shoulders, jaw, and joints of the thumbs and fingers. In extreme cases, the hip joint. The main aim is to prevent further movement of the joint by immobilising the injured area in the position found, together with treatment for pain.
At some point in your life, perhaps as a child, you're almost bound to have twisted an ankle and someone's applied a cold compress to it, maybe wrapped it in a crepe bandage. It's one of the commonest areas in which we can suffer simple strains.
Sprains and strains are classified as soft tissue injuries. Muscles and tendons may be strained. A strain occurs when the muscle is overstretched and may be partially torn. This often occurs at the junction of the muscle and the tendon that joins it to the bone. Ligaments, however, are sprained. This is a tearing of the ligament at or near a joint, a common example being a sprained ankle. Soft tissue injuries are treated using a simple procedure called RICE. The mnemonic stands for rest, ice, compression, and elevation. Injuries to the spinal column are a particularly serious form of musculoskeletal injury. Dislocated or fractured vertebrae could move, causing serious damage to the spinal cord. Spinal injuries should be suspected where other major injuries are present or significant forces have been applied to a patient, for example a fall from 2 meters or more. All suspected spinal injuries must be fully immobilized, initially using manual stabilization of the head, neck and back. On your vessel you have several specialized devices to enable the head, neck and spinal column to be immobilized other than by manual means. Rigid collars must be applied in the correct manner to assist in the immobilization of the neck, but additional actions for more serious injuries may be necessary. Whilst a correctly fitted collar protects against flexion and extension of the neck, the same cannot be said as regards rotation. Your vessel will be equipped with a long board or spinal board, which is perhaps the best device for immobilizing the neck, spine and rest of the body. Patients are normally placed on these boards by controlled sliding, log rolling or flat lifting depending on the circumstances. The log roll can be accomplished using 4 persons in the appropriate positions. The person controlling the head is always in charge of all movement. Manual immobilization of the head and neck should be maintained whilst the patient is strapped securely to the spinal board. Once the torso and limbs are secured, the head blocks and straps are applied to complete the process of immobilization. Adapted basket stretchers can also provide good immobilization for the spine and body. With all musculoskeletal injuries, pain is a significant issue and is detrimental to the casualty's condition. Entonox would normally be offered early in some of the treatments we've mentioned, ideally before immobilizing a broken limb, for example. Exceptions to the use of Entonox include chest injuries, spinal cases until they are fully immobilized, facial injury where a good mask seal is not possible, head injuries or casualties with reduced levels of response, confused casualties, and casualties suffering from decompression illness or having undertaken diving duties in the 48 hours previous. In such cases, consideration should be given to the different forms of analgesia available and, if suitable, administered on medical advice.
In summary then, fractures to smaller bones, although they can be quite disabling, are not significant in terms of shock. However, multiple fractures, particularly to larger bones which may or may not be complicated by tissue damage, can be life-threatening. Initial treatment will usually be immobilization and some form of pain relief.